Welcome to CareTalk. I'm David Williams, President of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. So David, did you learn more than our Congress people did from Mark Zuckerberg's testimony this week?
Well, I enjoyed it. You know, my first takeaway was...
How could you enjoy that endless testimony?
Well, what I liked was I liked the ties, and so you can see I'm wearing my Facebook tie here. It looks like you put on a Twitter tie. You may have missed out a little bit there, John. So I may have learned a little bit more than not just the Congress,
they weren't getting grilled.
Than you as well. But I thought his testimony was fine. But what you basically saw was that as expected, you know, the customer, really the user is just the fuel and the product for Facebook and your data, and that's it. And they're not really going to change.
You would know because you provide a lot of fuel.
I am the fuel.
David, the most important thing that I think our Congress people missed is that the kinds of protections that we have in healthcare are not available online where we live most of the rest of our digital life. And yet your zip code, which is easy to get to with the rest of your digital information, is more predictive of your healthcare status than your EMR. If we know that we need to protect healthcare information and report on breaches in healthcare, we should certainly have the same protections online in the rest of our digital life. It's unfair to push that onto the customer, and I think that got missed, and I think you're missing it.
I may be, John. I mean, what I like to see though is the healthcare data, instead of having just to focus on protecting it and hugging it and keeping it close, is if we can actually do a little dance with it and also make the most out of it, so that we can get all the insights that are needed for the right diagnosis and treatment and cure, and screw Cambridge Analytica and all those others that may have it. We got to get out of defensive mode and really start to exploit the data and leverage it. And I think Zuckerberg may...
That would be additive only if it's safe. Okay. We've got to make sure you make it safe and that it's accurate, that you sanitize it. And then I think linking it with the rest of your digital healthcare information makes a lot of sense. But it should be your choice. It shouldn't be some Russian friend of yours' option.
I'll tell you what, John, let's get into our hoodies for the next episode, and then we'll take it from there. Let's talk about the real world a little bit, which I know you're not that comfortable with. But if you think about Wal-Mart, there are some rumors swirling around about an acquisition of Humana. Is that a good idea for them?
Well, I think it's a really interesting idea. I think if we could start to bring some of the principles of retail into healthcare, that's all to the good. A lot of the other deals I'm not so sure of, but here you've got two companies, Wal-Mart and Humana, that have worked together for many years. Humana does a terrific job in Medicare, and particularly on the drug and the insurance side. Wal-Mart has brought real value to consumers all over America. If you think about saving money, living better, having a bit more transparency, and getting real value,
John, you should have one of those vests on as a greeter. You sound like a real advocate.
I am.
Doesn't go with the tie, though.
I am an advocate. What's wrong with getting value for healthcare? I mean, I think that
who can argue with that?
That would be a good thing. Well, you can.
I'll argue with it. So, John, I think that Walmart has been getting kicked around by Amazon pretty well, and now they're sort of coming.
It's doing fine.
Now they're coming late to this party. And here's an idea. We'll acquire a health plan. Gee, didn't I just hear about that from CVS and Aetna and from Cigna and Express Scripts? Okay, I'll be the third one to do it.
They're more deliberate, but they started many years ago. They went to $4 generics. They've got a track record of providing value. Value is what people first complain about in healthcare, and after that, outcomes. I think it's a move in the right direction.
So, John, you're a big supporter, of our military and our veterans, and so I'm sure that you are excited to see a new VA secretary who has the full confidence of this president to be nominated for the post of VA secretary. What say you?
Crazy. I mean, I don't know what's more dangerous with this president, being around him when you've got a job that he gave you or being available when he needs a job filled. There is nothing that obviously qualifies that particular doctor or any doctor who just happens to be in the president's eyesight. This is a $200 billion bureaucracy with a lot of challenges. It's taking care of some of our most damaged and vulnerable fellow citizens. We could do a heck of a lot better. I hope he's not confirmed.
So, John, the thing is, when you say 200, it reminded me that this is the Ronny Jackson, the president's doctor, also said the president could live to be 200 if he didn't eat so many hamburgers because because he has such great genes. So maybe he's going to take the hamburgers out of the VA cafeteria. And
that will
solve things.
That will keep him.
But who's going to be who's going to be the new doctor for Trump? I mean, who's going to take that job? Maybe Dr. Paul Ryan. What do you think? Not ready for that question, huh?
I think that.
Are you angling for the job? Yeah, you could take night courses. All right.
I think that what we need to really focus on is not the absurdity of the personnel, but
Dr.
the danger of the policy. I think that what really worries me about this administration is the way they're going after regulation. I mean, it's your administration. What do you think about this regulatory reform approach that's happening throughout government?
That looks like Nixon with that with the air quotes. So what's happened here? There are intelligent approaches that can be taken to deregulation. If you look back at like deregulation of the airline industry, there's some good examples out there. This is just about sort of saying, just get rid of it. And if you look at nursing homes as an example, they decided, well, the inspectors were too aggressive during the Obama era. So they basically said, let's call off the inspectors and make it so that you can have violations that are so damaging that they could actually kill a patient and you still wouldn't be fined. And at the same time, they're allowing the nursing homes to put the patients and their families to require binding arbitration. So I think it's nuts. I think you're going to see just the regulation just stripped away. And while you could theoretically use that to improve quality or cut costs, really it's just the boomerang is just going to go back, or the pendulum in the other direction.
We may actually have found something we agree on.
Really?
Everyone agrees that some amount of regulatory reform makes sense. But what this administration is doing is taking a hatchet, not just to individual regulations that will affect people short-term like in nursing homes, but things that will really affect us as a society and our health long-term by allowing coal plants to kick more pollutants that can going to cause cancer into the air, allowing folks who are to dump more cancer-causing agents into our waterways. Everyone agrees with some amount of regulatory reform, but not the rejection of government protections that frankly have been around since the Republican administration of Teddy Roosevelt. I think we can agree on that.
So John, it's so depressing, but you know what might cheer us up?
What?
The lightning round.
Awesome. Ready for it.
John, will Obamacare be a winning issue for Democrats in the midterm elections?
I think everything's going to be a winning issue for the Democrats in the midterms. The Republicans are having a hard time keeping people even in Congress.
I think the Republicans are going to run on Hillary's emails.
David, 2/3 of Americans over 65, including you, take vitamins. Is that a good idea or a bad idea?
Well, John, you're just full of statistics and insults today, but I have to say that vitamins don't really have any
matter.
There's no rationale for taking them because they generally don't work. But people take vitamins on the one hand, but on the other hand, they don't take their meds for high blood pressure or other chronic conditions. So go figure.
Well, it's crazy, but look at all the money that's behind it. Maybe we should get Big Pharma paying for ads to actually get people to take their chronic care meds.
Is Viagra a vitamin? John, this administration is very anti-immigrant.
No.
It is. And as the immigrants are pushed out or not let in, is there going to be an impact on healthcare?
Oh, absolutely. I mean, 1 out of every 5 employees in healthcare is an immigrant or a recent immigrant. The first place you're going to see it is there's a potential to have no home health aides. It's crazy. So, David, Major League Baseball has kicked off. Who's going to win the World Series?
Oh, it's Boston Red Sox. Their year. It's their year, John.
New York Mets.
Oh, you're killing me, the Mets. I hate the Mets. What are you talking about, Mets?
MVP?
Tom Brady, come on.
Oh, it's definitely Tom Brady.
Well, that's it for this episode of Care Talk. I hope you enjoyed it. And if you did, make sure to subscribe on your favorite service. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Thank you.